This podcast represents a brief history of the law relating to the issues raised. This should not be relied on as a substitute for professional advice. Specific legal advice should always be sought in relation to any particular circumstances, and no liability will be accepted for any losses incurred as a result of reliance on this podcast by those relying solely on this podcast. Welcome now to Hicksons Health Hour, the podcast series that explores a variety of current legal health topics. Throughout each episode, hear from different members of our health team with expertise in the area. Welcome. Today we're going to talk about the rise of Ozempic lawsuits in the United States of America, and specifically the claim that the drug causes gastroparesis. To begin with, what exactly is Ozempic and what is it used for?
Ozempic is a drug developed by Novo Nordisk for managing type 2 diabetes. Ozempic's active ingredient, semaglutide, is designed to regulate blood sugar levels and, by extension of this, aid in diabetes management. It works by mimicking a hormone known as GLP-1, which stimulates insulin secretion and lowers blood sugar levels after meals. This mechanism helps patients with type 2 diabetes achieve better glycemic control, making it a valuable tool in managing the chronic condition. Designed as a once-weekly injection, Ozempic offers convenience compared to daily medications, contributing to its popularity among patients and healthcare providers alike.
So why has it become so popular?
Well, since its approval by the US Food and Drug Administration in 2017, Ozempic has gained significant popularity not only among diabetic patients, but also in off-label use cases, particularly for weight loss, which is a demand fueled in part by a high-profile media coverage.
But there is a downside to this popularity and perceived benefits, isn't there?
Well, Ozempic has become the subject of numerous lawsuits. Plaintiffs allege a range of grievances, from claims of severe, unanticipated side effects to accusations that the pharmaceutical maker failed to adequately inform patients and healthcare providers about the potential risks associated with the drug. Some have claimed that Ozempic's manufacturer has intentionally blurred the lines between Ozempic's intended purpose and its weight loss potential, indirectly encouraging consumers to use the drug off-label. These allegations raise significant questions about Novo Nordisk's marketing strategy, especially as demand for weight loss treatments continue to grow.
So what is at the very heart of many of these lawsuits?
It is the question of corporate responsibility, that is, to what extent a pharmaceutical company is accountable for informing consumers about the risks of their products, and where should the boundaries of drug marketing and promotion be drawn. In general, it's expected that many of the medications we consume will have side effects to varying degrees. Some of these side effects are accepted because the implications of not treating the health needs of the individuals are worse, referred to as the therapeutic ratio. Some have claimed that Ozempic's manufacturer has intentionally blurred the lines between Ozempic's intended purpose and its weight loss potential, indirectly encouraging consumers to use the drug off-label. These allegations raise significant questions about Novo Nordisk's marketing strategy, especially as demand for weight loss treatments continue to grow.
So what do we know about gastroparesis?
Semaglutide can slow down or delay gastric or stomach emptying, and in some people result in a condition known as gastroparesis. It's defined as unobstructed, delayed stomach or gastric emptying. It's associated with symptoms including abdominal discomfort, bloating, nausea, and early fullness. Potential causes of gastroparesis include diabetes. However, there is increasing documentation of gastroparesis associated with the use of semaglutide. Gastroparesis can result in distressing symptoms, but also has other implications. In particular, can increase the anesthetic risk of aspiration of gastric contents into the airways and lungs of an anesthetized patient.
And what about the alarming side effect of blindness?
Well, on 3rd of July 2024, a study done by Harvard Medical School found that the use of Ozempic was associated with a type of blindness known as non-arteritic anterior ischemic optic neuropathy, or NAON. Research shows a diabetic user of Ozempic is 4 times more likely to be diagnosed with NAON, and a non-diabetic user of Ozempic is 7 times more likely to be diagnosed.
But every medication has side effects. Why is Ozempic such a focus?
While some side effects, such as nausea and vomiting, were mentioned in the drug's literature, plaintiffs argue that Novo Nordisk failed to sufficiently communicate the severity or long-term impact of these symptoms and dangers, especially when prescribed off-label for weight loss. One of the primary allegations is that Ozempic causes severe and in some cases life-threatening side effects that were not adequately disclosed. While gastrointestinal symptoms are somewhat common with semaglutide, many plaintiffs contend that the severity and the persistence of these side effects were downplayed. Additionally, the occurrence of conditions such as pancreatitis and thyroid tumors, particularly in long-term users, has raised concerns about whether Novo Nordisk fully disclosed these potential risks based on existing clinical data. Plaintiffs argue that Novo Nordisk had an obligation to more thoroughly warn patients of the potential risks.
Are there any other aspects of legal claims that are being brought?
Inadequate warning labels represent another significant aspect of these claims. Plaintiffs argue that while Novo Nordisk were aware of certain side effects and potential risks, the company did not effectively communicate these dangers to users. Many claim that the labels did not adequately convey the risks of severe side effects for specific groups, including individuals without diabetes who might use Ozempic off-label for weight loss. Claims suggest that Novo Nordisk may have minimized certain risks in order to maintain a positive image for Ozempic, particularly among non-diabetic individuals interested in weight loss.
It sounds like it's prioritized profitability over transparency.
That's certainly been argued. Marketing Ozempic in a way that encouraged off-label use while downplaying the associated risks. If proven in court, these claims could have significant implications not only for Novo Nordisk, but also for the pharmaceutical industry at large. These cases may set new legal precedents regarding drug warnings and marketing practices, potentially leading to stricter regulations around drug labeling and clearer guidelines for the promotion of drugs with off-label applications. Some plaintiffs argue that Novo Nordisk capitalized on the growing popularity of weight loss treatments by emphasizing the weight-related side effects of Ozempic, thus encouraging off-label usage. This alleged marketing approach, combined with widespread media coverage of Ozempic as a weight loss solution, is seen by some plaintiffs as a deliberate attempt by Novo Nordisk to expand its customer base beyond type 2 diabetes patients.
There are many cases currently underway, including multiple class action lawsuits. Undoubtedly, these will examine crucial legal questions.
As the cases progress, they are expected to illuminate legal questions regarding the obligations of pharmaceutical companies to provide comprehensive and clear warnings, particularly when off-label uses are involved. Furthermore, these lawsuits may set an important legal precedent for future litigation involving drugs with expanding usage profiles and potential side effects not fully anticipated in their original marketing approval.
But healthcare providers have a part to play also. What are their obligations?
The Ozempic lawsuits also do raise significant questions about the role of healthcare providers in navigating drug safety and patient communication. Healthcare providers have a critical responsibility to assess the benefits and risks of medications for their patients, but they also rely heavily on information provided by the drug manufacturers. In cases where information may be incomplete or inadequately communicated, healthcare providers can find themselves in difficult positions, potentially prescribing medications without fully understanding the risks. The Ozempic lawsuits highlight the need for clear and comprehensive communication from the pharmaceutical companies, ensuring that healthcare providers have the knowledge to inform their patients accurately about the drug risks. Furthermore, the popularity of Ozempic for weight loss, despite its intended use for diabetes management, emphasizes the need for healthcare providers to exercise caution when considering off-label prescriptions.
In summing up, these lawsuits highlight the ethical responsibility of pharmaceutical companies to prioritize patient safety, even when financial incentives encourage broader or more aggressive marketing practices. We leave you today to ponder the question of whether pharmaceutical companies should be held to a high standard of transparency and restraint, especially when drugs impact large populations with diverse health needs. Upholding this ethical responsibility is essential for ensuring patient trust and sustaining a healthcare system that values patient welfare over profit.